All right, everybody, I hope you had a good Labor Day weekend here with Josh and Paul and our old friend, Dr. Albert Coe. Dr. Coe will be on in a few minutes. Just give us a brief update on a lot of the new therapies and testing and timing of vaccinations. There's been an awful lot of press, and let's see what's real, let's see what's realistic, and let's see what the timing of some of these things are, because they inform my thinking and our thinking in terms of the schedule of things going forward. Very quickly, we've got 3 days now of really first change since Friday, so a little more than that. What's important, I think, you see 49,000 tests, so we're still running at over 100,000 per week. The 417 positive cases, remember that's over 4 days. That's a positivity rate, yet again, under 1%. So that's all good news. I think I was particularly interested when Josh gave me the numbers on colleges, since you probably, that was one speed bump that I was worried about in terms of flare-ups there. And so far, I'd say relatively so good. We're watching like a hawk because you've seen some incidents in different schools, but fundamentally, we've done about 43,000 tests across our college campuses over the last 2 or 3 weeks. 166 cases, which means there's a positivity rate of less than 0.5%. And I was talking to Albert a little bit. I mean, obviously we have less community spread than a lot of these other universities, in Alabama, North Carolina, where the community spread is more severe. You see that reflected in some real flare-ups in some of those campuses. Thank goodness we're not there yet. And secondly, unlike some of these other places, we're doing a lot of testing, and certainly a lot of testing at campuses where you attract people from out of state, just to make sure we're able to do that safely. So far, so good on that front. This is just from Data Haven, just some interesting information, not fascinating, but it's sort of interesting to me how personal COVID has been for this state compared to perhaps some other places. 33% have a close friend or family member who is tested positive. 33%. 18%, almost 1 in 5 have a close friend or family member hospitalized due to COVID. And another 13 have a friend or close friend or family member who died. So this is a disease that's still close to our heart here. Going on to the next page, that's why, again, Connecticut, more than just about any state in the country, is more likely to be wearing the mask, 89%. This is good news. 87% believe their employers have done a good job in keeping them safe. I think that reflects the hard work that Albert, you and the reopening team, and David Lamont did necessary to put in place the protocols that we could reopen safely, which has been pretty successful so far. These next two are worth looking at. They're sort of mirror images of each other. 20% of Connecticut residents, according to the Data Haven analysis, do not plan on getting vaccinated at this point. And another 17% are unsure. And I think that reflects, and this is what Dr. Coe will be talking about a little bit, there's been some sense that maybe these things are being rushed, they're not going through the necessary protocols, they don't have enough time, or just a general anxiety about vaccines. I think that's something worth opining on. I think our public health team has done a really good job, and Deirdre Gifford, in terms of giving you confidence that we're not going to let anything happen unless we're convinced ourselves that this is the safest thing that we can do. We're looking for a lot of verification on that. You've probably seen that some of the leading drug companies, including those here in Connecticut, Sanofi and Pfizer, for example, have said they're going to act as a group, not wait for the FDA and see whether they're rushing things, and they're going to step in and be able to say, this is now a therapy or drug that I think you should feel comfortable taking. Max jumped in there. These are some of the things that Albert's going to talk about. But let me say one other thing on the last slide first, if you would. That is that, 72% believe that our Department of Public Health and a reopened committee and our state government is looking out for your best interests of you and your family. And There it's been sort of interesting. We've opened our schools, as you know. I think 60% of them are going to be either full-time or full-time within 3 or 4 weeks. I take that as pretty good news. 40% are hybrid certainly for the foreseeable future, as we try and give people some confidence there. Obviously, I've gotten a lot of feedback on football. As you know, the CDC and the national athletic leagues that CIAC are responsible to all made recommendations in terms of sports. They ranked them in terms of high risk and medium risk, indoor and outdoor. And they did categorize football, high school football, as a high risk activity. So that was a recommendation that came from both Deirdre as well as the National Federation, and that was a recommendation that CIAC, our Interscholastic Athletic Council, decided to follow and decided to put a pause on high school football. Same has been done, as you know, in Massachusetts and Rhode Island and New York, our immediate neighbors. And we can probably talk about that a little bit more, how CIAC came up with that decision and what we think about next. I, for one, personally think that I love football. I played a little bit. I know how important it is to families. I know how important it is to kids. I also know we want to do things safely. So Albert's going to tell you how the world could change in the next 4 months and how we have a football season early next year as opposed to doing it right now. With that said, let me just take you to these COVID headlines here before I hand it over to Albert. But I just thought this was all the things that are happening. You can spit in the tube and you can get tested immediately, or you can take a quick swab in your nose and do it yourself on a daily basis. Frankly, the saliva test came out of Yale New Haven, so Albert's got some insights there. You hear a lot of talk about vaccines. Let's get it done before the election. No, we won't be able to do it before the end of the year. Who's going to take it? Is it safe? Do you really want to take Vladimir Putin's vaccine? Probably not. So I think we'll be able to have some insights from Albert in terms of what we can count on in terms of vaccines, what you can count on in terms of testing, and what you can count upon in terms of therapies, what are reasonable and what are fantastical. Albert?
Yeah, thank you very much, Governor, for the invitation to talk and particularly to give an update about where we stand and where we're going in terms of new developments. And actually, I'm cautiously optimistic and actually quite optimistic about how the future is going to play out. I think, first of all, as you mentioned in those headlines, there's some new exciting developments. Let me first talk about testing and then go to therapeutics and then finish up with vaccines. I think that's on many people's minds. In testing, this is something that I think here at Yale we're particularly proud about. A lot of new innovation. There's the Saliva Direct, which has hit the headlines. This is a direct outcome or output of research led by Ann Wiley in my department at our school, at the Yale School of Public Health, where you can actually spit in a tube. They've developed a very quick, rapid and really cheap way of identifying the virus that caused COVID, just by an easily administered test. And you can imagine how, spitting a tube is going to be much more advantageous than having a swab, in your nose or in the back of your throat. So that's very exciting. I think, there's some hurdles, and I would say these are minor hurdles. These are hurdles with respect to getting, laboratories set up, getting regulatory approval, getting an implementation. But this is a potential game changer, not only here for the state of Connecticut, but more broadly. And the big issue is getting a test that's decentralized, where you can get your results within, whether it's minutes, hours, or within a day. That helps the contact tracing, that helps identify who's infectious, getting those people to stay home so that they are protecting not only their families, their communities, but the population in general. I think the other kind of game changer that's come out, which is very exciting was another type of technology. The first technology with the Saliva Direct developed here at Yale, at the Yale School of Public Health, was looking at the molecular pieces, and particularly what we call RNA in the saliva. The other game changer that's just come out, it's gotten EUA approval, was been the Abbott Binax test. And this is a rapid test, gives an answer in 15 minutes. It detects the antigen rather than the RNA. With the nucleic acid, it detects the protein produced by the virus, and it can be done very cheaply. This test is going to be sold for $5. So this is something that's exciting. One hurdle that has to come over is we know that works well when you're treating patients or people who are symptomatic or ill with the disease. One thing that really, as you heard time and time again from the governor's office, from Deidre Gifford, from Matt Carter, from Jafar Reza, who's the director of the State Health Laboratories, that we need to get in front of the curve. So what we need to do is to identify not people only when they're ill, but before they become ill, when they're asymptomatic. And one thing that we need, that needs to play out, and Abbott and its collaborators are doing it at this moment, how does this test do when we're screening our nursing home staff, correctional facility staff? We're going to screen people in our students in our higher education. That's one milestone that's going to happen. So, in summary, we have those two game changers. We're probably going to have several others that are going to come out and go through FDA approval. It's the emergency use authorization, what we call EUA approval, in the next 2-3 months. And I think, as we're going into that dangerous period, the period that we're all concerned about, when it gets colder, people are staying inside. We're going to be thinking about, we're going to hopefully have new tools in our prevention intervention toolbox that can be used. Let me move on to one before going to vaccines. And it hasn't gotten as much attention, but one of the fronts that I think all of us are worried about, especially myself, who takes care of patients, is the therapeutics. I think one finding that came from large clinical trials, both in England first and then now worldwide, some of them sponsored by the WHO, has been use of steroids. We know that for people who are severely ill or moderately ill with COVID, treating them with steroids up front cools down the inflammation and actually can make an impact on morbidity and mortality. The other one that I think we've all been anxiously waiting for is monoclonal antibodies. And there are several companies, both in the United States and internationally, that have been using that not only to treat people, but also to use them for prophylaxis, prevention. So you can imagine in a high-risk setting, such as nursing homes, if nursing home residents or nursing home staff are getting monoclonal antibodies given once a month, and how we can protect them against introduction and actually save their lives. So that, I think, is going to be coming around the corner. It's hard to know exactly when. I expect in the next 2 months we'll have new data for new therapeutics. Well, let's talk about vaccines. You can see the headlines, and you have seen also how this information how this issue has become somewhat politicized. Well, let me just say a couple. One is that there's been an unprecedented effort on vaccines. The effort of vaccines that are happening now kind of reflect what we were doing for polio back in the 1950s. Polio was a scourge of our young people in terms of causing paralysis and death. We have multiple vaccines candidates that have been developed. We have several. There's 3 in the United States that are phase 3 trials. These are trials that are enrolling 30,000 people. I think one of the ones which is probably more advanced is the Pfizer vaccine, which enrolled at least over 11,000 people to get to the landmark of 30,000. Everyone is working, very rapidly. This is under the aegis of Operation Warp Speed.
Max?
Dr. Ko, if you can unmute yourself, thank you.
Okay, I'm sorry. Max, just
It was
quickly.
right at the start of your the human trials.
Oh, the human trial. Okay, good. So we're taking, we have several vaccines in human trials. These are enrolling up to 30,000 people. Pfizer is actually probably one of the more advanced. They have over 11,000. These are going very quickly. I think, they're taking, what do you call it? This is an initiative that really harks back to what we did back in the 1950s and 1960s with a lot of our childhood vaccines. I think there are a couple of caveats to say. One is that many of these vaccines are going to take 2 doses. So maybe, although they started in late July and August, they're going to take 2 doses, spaced one month apart. And given that, and I know there's been a lot of dialogue in the press about, in a lot of comments about how we're going to get a vaccine by October. I just refer you to the statements of Dr. Moncrief Salui, who's the head of Operation Warp Speed. And these vaccines, he said, he actually gave an interview to NPR, saying the chance of a successful vaccine result by October is very, very low. And I think that's because of not only the fact that you have 2 doses, you have to look at enough events, infection events, and those people who didn't receive it, as opposed to those who received the vaccine, in order to understand how it's effective. But I think the key issue is that we want a safe vaccine. And I think there's a large consensus. The governor referred to the letter, which was signed by the CEOs of Pfizer, Moderna, Johnson & Johnson, GlaxoSmithKline, Sanofi Pasteur, the major vaccine manufacturers. And the reason why is that we don't want to repeat the problems, the problems that we've had in our past history of vaccines, vaccine hesitancy, and coming out with a vaccine that we don't know exactly how good the safety profile is. Just want to hark back to 1976. We had an epidemic, or we had an outbreak of swine flu. It started in Fort Dix, among soldiers. There was, this is under Gerald Ford, there was a large campaign to ramp up very quickly a vaccine for influenza. That vaccine was, associated with very rare types of complications. This is called Guillain-Barré syndrome. And that whole, controversy about potential side effects of a vaccine actually pushed us back in terms of public confidence in the vaccines. And that's the last thing that we want, with the COVID vaccine. And so that's why, the consensus, not only of the vaccine manufacturers, but all of the experts, is that we need to get the best. We need to be these decisions driven by evidence, and not by hunches, not by judgments, and not by certainly political motives. So that's why I think the consensus of everyone is that we would hope, if the evidence shows that it's ready in October, that's great, that it's safe and effective. I think most of us, and myself particularly, I think this is going to take a longer period, going out to probably November, December, and perhaps even January, until we get a safe and effective vaccine.
Thank you very much. I love that. Dr. Cole will be here for questions. I'll give you my summary, what I listen for in that. I think when it comes to our scientific innovation engines are revving up in this country, around the world, I think you're going to see some real game changers in terms of testing. We're already testing, acting as a real screen, what that means for safety in our schools, what that means for sports, what that means for business on a more regular, self-administered basis. I think that, Albert, what you said in terms of vaccines and therapies, we may be getting a little ahead of ourselves, but there's good news down the road. With that, Max, any questions?
Channel 3 Eyewitness News.
Yes, a question for Dr. Cole. Now in September, the state still has very good positivity rates. Are we at a place yet where we might know what a fall surge might look like?
Yeah, so, and again, I think you've heard it from many of the experts and many of the people in the governor's office that we really need to be humble about, what we know, what we don't know, and what we can project in the future. Just kind of refer you to what's happening in France, Spain, Italy, in much of Europe, right? Where they reopened quickly and, during the summer, and now they're in full-blown resurgence. So that resurgence can happen anytime. And obviously we're worried about what happens in the fall. We're reopening the schools. We're also having colder weather, so people are going to spend more time indoors. We know indoor environments are more, there's a proclivity for infections or transmission opposed to outside. I think, how that resurgence is going to happen. My own hunch, this is just my hunch, is that, it's going to be signaled from outside. We're going to have external threats. We've seen that in the South, seen it in the Western United States, that we have to be vigilant of these importations, constantly vigilant of importations into the state. I think the second thing that, resurgence, I'm not sure if it's going to be a resurgence or it's going to be a slow burn. We're going to have small outbreaks. I think with I think impressive effort the state has made in terms of ramping up testing, we've got probably an optimized system to detect those small little brush fires, and it'll be on us, on the Department of Public Health to put those out quickly. That's I think the best case scenario that we're looking at. But I think the issue is not just going to be influenza season. I think we're going to have to be in that vigilant mode. Starting, we've already been in that vigilant mode. It's just going to have to keep on going.
And Governor, if I may, you've been touring schools last week. You did some today. So far, what have you liked, and what do you think still needs improvement?
What I've liked is the enthusiasm of the students, the parents, and the teachers to be able to get back to the school, and the confidence they have that the administrators there have taken all the question. What are the concerns? As you know, my biggest concern has been in the college campuses, less so for K through 8. And I was at the School of Public Health today, and so far that preliminary testing, what we've done over the last 2.5 weeks, has been good news. But I still think my concern there is we've got the greatest risk there.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. In terms of the developments that Dr. Coe was talking about with testing, vaccines, and the treatments, how will those affect your thinking when it comes to moving to future stages of reopening the state? Do you have certain benchmarks that you'd like to see hit?
Well, first of all, what it says is everything, when it comes to the testing, if you can get that 5-minute test from Abbott Labs, if we can get that saliva swab done on a group basis, if we can get that pooling, we'll be able to really get control over the potential spread of this virus, where it's happening, and stop it before it starts. What does that mean in terms of stage 3? As you know, as I've said, a million times, we've got about 95% of our economy open. So the question is, what would come next? In terms of big indoor events and bars, I think we're not there yet, but if we see some of these things that are on the, not the horizon, but around the corner, that would certainly change our thinking.
And just in terms of the high school football that you were talking about earlier, obviously coaches and players and even some legislators are really pleading with you to give them a shot. Is the door closed? Is there still room for some type of compromise?
Well, I think CIAC maybe is going to be talking to public health and others. They've certainly been talking about a 7-person football, which is less contact-oriented, obviously keeping up the conditioning and the practice. Obviously, I thought very early on that, swapping baseball and football made sense. That is an idea that never happened. But I'd still like to see a football season a little bit later.
Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. Following with high school football, with no plan to play football this season, but with some of the best health metrics in the country right now, many families are just looking for a flat or simple answer as to why students can't play football when coaches and teams are willing to put in necessary safety measures.
Well, I think you'll find that Massachusetts, Rhode Island, New York, Connecticut, all have been probably on the stricter side when it comes to safety, and that's why we have the lowest infection rates in the country now, going on for 3 months. And you're right, all those states have put a pause on football. To be more blunt, the states didn't do it, but their local leagues, made the determination themselves that probably is worth pausing now, keeping going with the practice and the conditioning, and hopefully start something up in February or March. Paul, anything else to add to that?
No, I think you covered it well, Governor, and I'll also add to it, as I know this is the first day where we have about almost every school district functioning right now. We have about 41% of our school districts that are functioning at a hybrid level. So that means the local school districts itself felt that it wasn't to a higher safety level to have a full school day for those students. I think, as the governor has stated, and the Department of Public Health has provided their recommendations ever since August. The Department of Public Health provided saying that they should look for a later in the year option instead of the fall, with the main focus about ensuring that we get our students back into the school. And that has been the consistent message of this administration throughout.
And then, Governor, what's your response to members from both the GOP and the Democrats requesting you to get involved to meet with DPH and the CISD to find a way to allow high school football?
Look, I'd be happy to do that. 3 weeks ago, they were saying you're opening up schools too soon. I wish there were more parents fighting to get the schools open is a real priority, but most of the energy is around football, which is somewhat understandable. Look, I follow the CDC. I look at the national leagues and what they've said, the high school leagues, and I also listen to Department of Public Health. But at the end of the day, we leave it up to the leagues. Every state around the country has left it up to the local leagues. Here's our guidance. This is what we think makes the most sense. But if it'd be helpful to sit down with public health and football, I'd be, happy to do that.
And then lastly, could you comment on the Hartford School District having to cancel their first day of school due to the ransomware attack?
If the question was, yeah, they had to cancel that first day of school due to ransomware. It could have been a lot worse, but it does. These are cyber hacks that threaten to or shut down your system. To tell you the truth, when I was first elected governor, if you asked me what I thought was going to be the biggest risk, I couldn't even spell coronavirus, but I have been really thinking about cyber attacks. And they have not gone away just because we have a COVID crisis right now. We were reminded of that with the attack on the Hartford school system, but they'll be open tomorrow.
The Day of New London.
Hello, Governor. I wanted to ask if there's any update regarding the COVID outbreak in Norwich. Anything new regarding either the nursing home there or Bacchus Hospital, and establishing the link between the two. Will there be enforcement action there, and should we expect that at some point there'll be a report on the investigation into that situation?
No, there'll be a report, but Josh, you want to follow up?
Sure, yeah. So the Department of Public Health, who's handling the investigation, has already published one report for the federal government and CMS, and that's been made public last week, or even the week before perhaps. And then Department of Public Health has indicated that they also will be coming forward with additional state-level findings, which have not yet been released, but continue to be in the works. And DPH continues to work very closely with both the nursing home Three Rivers as well as Bacchus Hospital to make sure that all the appropriate steps are being taken to protect residents and staff in both of those facilities.
All right. Thank you. All right.
The Associated Press. News 8, and a reminder for anyone joining by a telephone, hit *6 to unmute. Once again, if you're joining by telephone, hit *6 to unmute. News 8.
Okay, Governor, just back to what we were discussing before regarding Hartford and having to postpone today. Do you think that the security system that was put in place helped it to not be worse than it was today?
I certainly saw what Luke Bronin said, and it made good sense to me. Look, we were beginning to hardening all of our technology around the state. We got a long way to go. We got some, 25-year-old systems in this state. But we are beginning to put in the filters necessary to detect some of these intrusions. We're doing a lot more training for our personnel to make sure they don't open up unsolicited tags that maybe bring with it a virusware. So I think we're better off today, but we are by no means safe from these attacks.
Now, with the possibility of phase 3, I guess it's been a little bit more than a month since it was put on pause. And I believe if we were under 3% positivity, that was going to be the benchmark. We've been around 0.8. So did something else, was there another change that had an effect on reopening and getting to phase 3?
Yeah, I don't remember the 3% as an absolute benchmark, but I'll tell you what affected me. Talking to the governors of Arizona and Texas and Southern California, where they opened up the bars, not to mention Florida. They all regretted it. They said we had very low positivity rates, and then things began to catch on fire, and they thought the bars were one of those places that was quite incendiary. So, look, things are going to change. You've heard about some of the amazing scientific innovations that Dr. Coe was talking about, but I don't think, not yet.
CT News Junkie.
Thanks, Max. So, Governor, is there any consideration that the administration would begin to redistribute PPE to home health aides?
My understanding is we were always a backstop for home health and backstop for the nursing homes, and they were desperate, and they couldn't figure out a lot of the PPE back when there was a supply and demand disconnect out there. Today there's plenty of PPE. You can get that available to you. But as Josh will explain, we're still a backstop. Anytime you're in need, we're there to back you up and make sure you have the masks necessary to go in there safely. We're not doing this automatically for everybody all the time, but we'll continue to be the backstop necessary to keep you safe.
Josh, did you want to add anything?
No, I think that's right. I think as we've discussed before, both Department of Public Health and our mutual aid program, as well as DSS and their support of the home health aid program, have constantly been reevaluating distribution strategies based on, as the governor said, how much PPE those individuals are able to attain on their own and what type of PPE is required. And so that will continue to moderate. I know that we'd heard feedback from some of those entities that they didn't want anymore because it's been piling up so much. So we want to make sure as an overall strategy that no one goes without PPE who needs it in those critical environments. And we have very rigorous policies in place to make sure that that's the case. And that we set up the repetitive processes to make sure that we're not providing more than is necessary, or we're not providing it to a business that should be able to obtain it on its own as part of their business, as the governor described.
But these home health care workers make less than $30,000 a year, and they're taking care of Medicaid patients. It doesn't seem that they would have the means to be able to continue to purchase.
Yeah, and just to be clear, for the home health aides in particular, nothing's been cut there. We continue to ship PPE to anyone who needs it any week. And as I mentioned, to the point where some of them have said to stop sending it because they have so much. So we are making sure that those home health aides have the PPE that they need.
Okay. Thank you.
Connecticut Public Media. Hit *6 to unmute.
Afternoon.
We can hear you. Go ahead.
In terms of the survey results showing that 20% of Connecticut residents wouldn't get a vaccine, 17% unsure, how would the state work to boost confidence so that that number lowers? Well,
I'll start with that and then get some help here. Look, we can't do all this by fiat. When it came to, for example, testing and testing in, say, African American or Hispanic communities, they are much more likely to want to get tested. They're actually a little less likely to want to be vaccinated as well. Perhaps a certain, worry about what happens with a test like that or what happens with that vaccine. I got to do a better job of education. I've got to do work with the churches. I got to do everything I can to give people confidence that we would never be asking you to, first get tested and then try a vaccine until we're absolutely certain it's safe. It's safe for you, it's safe for your family, and it's safe for your community. And that's something we're going to have to work on every day. Anything to add to that, Dr. Coe?
Yeah, I would just say that, Connecticut probably has, in terms of vaccinations all across the board, but particularly also with influenza, has one of the highest rates or coverage in the country. And so we have a population that is actually very much, imbued into public health and understanding the role and importance of vaccination. That 20% rate, it's high, but actually if you look across the board, with other states, they're having much higher rates of vaccine, what we would call vaccine hesitancy. So I'd actually see that as a positive. As the governor said, there are priorities with that. Vaccination rates in our underserved communities, as well as in our people of color, are lower than what we would want. These are the communities which have taken the hardest hit during the COVID epidemic. And these are the communities that we would want to get vaccinated, not just only for COVID and for influenza. The governor's office has a team, the communication team has been working since actually April in terms of really ramping up messaging correctly to the communities where we need to do a better job. Those communities that got hard hit or had the highest burden. And that's going to have to go through not only to influenza season, but when we do get a vaccine. Hopefully that vaccine will be available, for people in Connecticut, at least by early 2021.
The Connecticut Mirror.
Hi, I'm curious about the September special session and if the governor has any priorities that he would like to see be taken up during that session.
The question is the priorities for the special session. Look, I was talking to Senator Needleman today, Dave Arconti. I think I'd put energy near the top of that list. We all remember what a hit we took to our electric grid and the outages and what that meant to us a month ago. And we got to do a better job as regulators to make sure that we mitigate that doesn't happen again or people or the consequences to pay. So that's my priority.
Is there anything in terms of those who have been impacted by COVID and are still feeling the lingering effects of COVID? Anything legislation-wise that you'd like to see? Anything like maybe rent relief for individuals who are struggling to make their rent while they're trying to find a job?
Yeah, the question was regarding COVID and perhaps rent relief and other supports we have. That doesn't all require legislation, but those are things that we're constantly evaluating going forward. And we're evaluating that in the context of what, if anything, we can expect from the federal government, because they were thinking about additional rent relief and mortgage relief just so that the landlords would have some support going forward from there. I think more broadly at our end, now that we have the emergency powers through February, that doesn't mean we're keeping these EOs going through in February. So Paul and Bob and the team are going to be going over those EOs, seeing which ones have timed out, how relevant they are now that we're in a different context, and frankly, working with our friends in the legislature to come up with the right mix there.
Thanks.
The Waterbury Republican American. Press *6 to unmute.
Me now?
We got you.
Thanks. This is a question for Dr. Coe. Is there any possibility that you see that there wouldn't be some sort of surge or resurgence in COVID come November, December, January?
Yeah, I would hope so. I think, again, let me answer this question with, kind of a response to a previous question that was posed to the governor. There's a thing that we call the public health paradox. Right? We don't see cases, and so, we've put in good, effective prevention. We don't see cases. And then that's the paradox. They said that why do we need to put in these interventions? We're not seeing cases. And that's a whole problem with metrics and so forth. So I think we've got the fundamentals down right. We've got a lot of testing on board, detecting outbreaks, responding to, and DBH is responding to those outbreaks quickly and effectively. The Norwich outbreak is a good example. The Danbury outbreak is an example. It would be my hope that that we would, with the the rules on travel restrictions and quarantine, that we could be in containment phase. Okay, we'd be in a phase where we could contain the virus with the strong social distancing. And again, the heroes of this story are the public of our fellow citizens in Connecticut who are using face masks, who are continuing social distancing. So I think that's the best case scenario. That's the scenario that we're trying to work for. And that requires the types of guidance, I think the courageous decisions that DPH, the governor's office, made with really doing evidence-based, interventions, knowing, learning from other states, what went wrong, whether it's bars, whether it's athletics or sports or types of outbreaks, and then using that judgment to guide policy here in the state. So I would hope that's the scenario that would play out, that would prevent a surge, as we're going into fall season, into winter season.
Yeah, Paul, I'd add to that if I could. Look how much we've changed our minds in terms of, we thought, oh my God, as soon as hot weather comes, remember that in April, hot weather will kill the virus, and wait till April, wait till May. Well, that didn't happen. In fact, you saw in places like Miami and San Antonio, hot weather, and there was a surge. Maybe people were going indoors more. Then we thought, okay, probably we're going to see some sort of a surge in November when it gets a little colder. And all of a sudden we saw Spain and we saw parts of France hockey stick up as well. So, we're continuing to learn on this every day. My instincts would be, if we can get through the college reopenings, we see what happens in the flu season in November. If we can get through that, we get the fast testing, we're in a new place, but we're not there yet.
Okay, Governor, and how much are economic considerations, sort of the repercussions on the economy and employment, going to enter into your thinking on imposing any additional coronavirus restrictions or relaxing restrictions as we go forward?
Well, as you know, Paul, we opened up our economy cautiously, and one reason we did that was I didn't want to have to backtrack, as you saw happen in dozens of other states. I thought that would have been a body blow to our confidence. And again, a lot of our economy we never closed down, like manufacturing, outdoor construction, and that which we've opened, we have kept open. It does represent about 95% of our economy, and I don't see any need to backtrack now.
Okay, thank you.
Hearst, Connecticut Media. *6 to unmute.
Hi, Governor.
We got you.
I'm still on mute.
Nope.
Okay. Yes. No,
You're good.
Sorry about that. I've had trouble with audio today, and I apologize. Dr. Coe, so is it still about 8 to 14 days before we figure out how everybody did over the Labor Day holiday in the realm of social distancing?
Nope. We lost Albert Coe briefly,
Yeah,
but
sorry. Sorry about that. I pushed the wrong button to unmute, so I'm having the same audio-visual problems. But thank you for that question. So, 8 to 14 days. So just to give you an idea, so if you have our typical incubation period is about 5 to 7 days after, let's say, somebody's got a transmission event. But actually to pick up the signal through whether it's people asking to get testing or so, that could be only detected maybe 2, 3, sometimes 4 weeks ago. We just have to look back at what happened in New York, our own experience here in Connecticut. But in the initial surge, there's probably transmission happening in the community 2, 3, 4, 5 weeks before we are able to detect, the surge in New York there. So I think the bottom line is that we should be vigilant now, and we're going to have to be vigilant in the next several weeks, really, to see what happened over Labor Day.
And do you have any personal feelings about some of the information that's been coming from the White House, or misinformation that's been coming from the White House?
Not really any personal feelings. I think going back to first principles. And again, I have to explain, but I really don't know what were the motivations behind the statements made by either the federal government or the White House. I think the bottom line is that you've seen this not only here in the United States and different states. You've seen this in other countries. I've worked in Brazil. Clear evidence-based policy is in the light of a pandemic is always the best solution. And when you veer off from when your decisions are not made by a good, thorough review of the evidence, one gets in trouble. And I think proactively, we're going to have to deal with that, whether it's testing, whether it's therapeutics, or it's vaccines. And we've seen this whole controversy about hydroxychloroquine and how it diverted us from really, I think, the important work that needs to be done in issues of bandwidth and really prioritize. So I don't really have any personal, feelings about or personal opinions about what's coming out of the White House, but just to really to emphasize the importance of evidence-driven policy. And these are lessons that we learned back in 1918 with the Spanish influenza epidemic.
God, Doctor, you're glitching in and out, but I'm sure it will be okay on the recording. Governor, the New York Governor Cuomo wants every school in New York to check in every day with their total infection reports. Is that something you're contemplating?
I think we're probably getting some that information right now, and I think it is very helpful as we try and track. I saw the preliminary list of schools and opening and infections. Right now, it's obviously very, very low, but that's good information. It's one more heat map where we can see if there's any risk situations.
And Governor, among the executive orders that you'll be reviewing, will you be looking close at the legal immunity that's been given to hospitals and nursing homes during the pandemic?
I think we will be looking at that. Yeah, Ken.
Okay. Well, thank you. Thanks, Max.
The Hartford Courant.
Hi, everybody. You just kind of touched on this a second ago, Governor, but what kind of reporting is there, what kind of tracking is there in terms of positive cases among students in a given school, in a given town, in a given county, et cetera?
Well, we're not, testing individual students, as you know, right now, but we are getting some information from schools. Anything else on that, Josh?
Yeah, that's all being collected by local health departments, and where there are cases or clusters, that's being reported up to the state. And we are looking at, whether we want to put in place a more formal process around that. So far, very, very little activity at the local level for K through 12.
So we did see today that Valley Regional High shut down after a couple positive tests. Do you expect that that's what the next few months is going to be like? Are you concerned that we've already seen a school that had to shut down?
Well, remember, with the cohorting, you shouldn't be having to shut down a school. We're trying to limit that class to that group of people. If Valley is a high school, that's a different situation because it's not as easy to cohort, which is why we're much more likely to have the hybrid situation there. So at least you limit the number of people who could potentially be exposed to, say, no more than half the school.
All right, thank you.
Right, I'm getting the signal. Look, I can say thanks for being here to everybody in English, but maybe I can get Dr. Ko to say it in Swahili and Portuguese just to say farewell.
Bom, muito obrigado a todos e foi um prazer e até próximo.
Yes, those are my sentiments exactly. Thank you, everybody.